Hello. So, based on our reading of Theory and Practice of Counseling and Psychotherapy from our Corey textbook, I see more similarities between narrative therapy and solution focused brief therapy than I see differences. Some of the highlights of solution focused brief therapy are that it's a client directed and collaborative approach between the client and therapist, where the client is really encouraged to learn and kind of recognize their own personal abilities in finding solutions to their problems, more so than the counselor kind of directing them towards what they think the right solution might be. It also is very similar to positive psychology in this way because it's such an optimistic view on the client's abilities and their knowledge of themselves and seeing themselves as their own expertise on their life. One of the other things of note is that in solution focused brief therapy, because they're not focusing on the causal root of a problem, there's very little focus or attention on the history or forming a diagnosis of mental illness for these clients. It's really just a very brief therapeutic approach to find the most effective and the quickest way to find solutions to someone's problems that they're dealing with. It's kind of like a empowering for the client in that way also, because it forces them to see themselves in a more positive light. So narrative therapy is very similar to that. It's another postmodern approach that focuses on the client-therapist collaboration and the client having the most knowledge of themselves and their problems and the most ability to find the solutions for those problems. There's, again, not a huge focus on diagnosis or history in this one, and some of the main differences are that this approach kind of requires the counselor to listen slightly more to their history and their story, because they don't have to, but they do kind of like a double listening where they listen to the client talk about their problem, and then they make an assessment of the client and an assessment of the problem, and they view them as separate entities. So this kind of is good and bad in itself, because it kind of takes away from the client's responsibility for their actions by kind of separating them into two different entities, but I'll talk about that a little bit more later. Another difference is that narrative therapists believe that problems are multidimensional, and so that when a client comes in with a problem, they believe that the influences of social, cultural, and political life experiences have a significant cause on and effect in the problem that was brought to the counselor's attention. For both the solution focused brief therapy and the narrative therapy, there's a huge focus on language and the way that the client talks about themselves and the way that the client talks about their problem. And there's a huge focus on changing that language, more so in the narrative therapy, changing the language than there is in the solution focused. That one's just kind of like assessing or paying attention to the language that's used, whereas narrative therapy is more using the language that's used and making conscious decisions to change that language as part of the growth and processing for the client. Some of the strengths and limitations are that the solution focused brief therapy is very, very brief. It's like 3 to 8 sessions, and most clients really only go for 1 session. So a limitation for that is that it's kind of hard to track progress, and it's kind of hard to see if you've really helped find a solution to the problem if they only go for 1 session. Maybe they're only going for 1 session, though, because that solution was the quickest and most effective, which is the goal of that therapeutic approach. In this way, it also does really put a lot of trust in the client, that they know what they're doing, and they just needed to kind of be pointed in the right direction. So by forcing them to go through this process rather quickly, it tells the client that they don't really need the therapist to tell them what the right solution is. For a limitation, it kind of takes away the collaborative nature of the therapeutic relationship by not necessarily listening to a client if they want to put more emphasis or more value on their problems, their past experiences, and kind of rehash things and go through those a little bit slower. This approach isn't really appropriate because it would mess with the collaborative dynamic that it strives to achieve, just by design for the therapeutic approach itself. For narrative therapy, one strength is that it does take into more of account what the client views as valuable for a contributor to their problem, because it's listening to their story and it's helping them change that story and change the language within that story. And then, like I said earlier, one huge limitation to the narrative therapy is that it takes away the responsibility of the client and their influence on the problem and the actions that they took to that also caused that problem, because you're separating the two entities when you do the double listening, and you're taking away the problem aspect of the client and making it a whole separate thing. Some of the ways that each therapy is either compatible or incompatible with Christian concepts, according to the Counseling and Psychotherapy book by Tan, written in 2011, is that the solution-focused brief therapy focuses on changing behaviors to solve client problems, which is consistent with the fourth biblical perspective of human nature, stating that like your problem behaviors are what fuel the problem feelings or problem thoughts, the things that are causing you distress. So just like the overall view of human nature in that sense. For narrative therapy, the reconstructive and transformative nature of narrative therapy is compatible with Christian therapy, and our transformative power that we put in the Holy Spirit of our Christian faith. The belief in free will for both of these therapeutic approaches is also very consistent with our Christian beliefs, because we are empowering our clients to make their own decisions and trust in themselves, that they know what is best for themselves based on what their situation needs, what their life goals are, and everything like that. In the same sense, by giving the clients all of the power, though, there's like a slight incompatibility because it takes away that sense of a hierarchical relationship with the client and someone else. It puts all the power on the client, and in this sense, for like a Christian viewpoint, it kind of would take then away the power of like God and the power that he has over our lives and everything. So as far as limitations on creating measurable outcomes for clients, the solution-focused brief therapy has a limitation of the fact that it's such a brief therapy. It doesn't allow for a lot of time for the counselor to track progress and assess progress that's being made. It's very much so that they're going to point them in the right direction and have faith and trust and believe that the client is going to make good decisions from there on out and use that as a template for making decisions from here on out that are maybe not going to cause as many problems for them. For the counselor, that puts a lot of faith from them on the client, and it takes away their ability to ensure that they helped the client sufficiently and pointed them in the right direction, because they usually, or not usually, but they wouldn't necessarily have the client coming back for more sessions to be able to make that assessment. For narrative therapy, this therapy is more of like a frame of mind. It is more of like a a view of counseling more so than like a set of techniques that can be used like in other therapeutic approaches. So in this sense, it's also another limitation of tracking progress because it's more so focused on how you interact with the client more than what you do. So the what you do and how you would track what you do with the client is missing in this therapy. Ultimately, I think that there are a lot of positive aspects to both therapeutic approach. I really like that it does empower the client so much and place so much trust in the client. And yeah.